The internet kind of blew up last week, not because of the TikTok ban, but because of this article in Press in Resuscitation that looked at the effect or non-effect of many of the treatments that we use in the treatment of patients with suspected hyperkalemia. A bunch of FOAMed people posted, shared, and recirculated the journal, and I got many questions in my inbox about whether we should stop giving calcium for patients with suspected hyperkalemia. Like, I know, I'm just some blowhard paramedic with a podcast. First off, we should never just be blindly giving calcium to someone who we think might be hyperkalemic. We give it when the patient is symptomatic, they have a history supportive of hyperkalemia, and there are EKG findings suspicious for hyper-K, like low heart rate, wide QRS, and loss of a P wave. Recall that the calcium has no effect on the potassium level. Rather, it antagonizes the potassium's negative effect on the cardiac membrane. In essence, it protects the heart from the hyperkalemia. But back to the new article, it kind of threw cold water on the benefit of giving calcium to patients with critical hyperkalemia. First, you have to read the paper for yourself. It's open access, so no excuses. There's a lot in it. It's an analysis of 101 articles published from 1977 to 2024, looking not just at calcium administration, but all things hyperkalemia: insulin, bicarb, albuterol, cardiac arrest, non-cardiac arrest. And the outcomes that they used range from specific to pretty subjective, in my opinion. This is why you have to read an article in its entirety. As far as calcium, they wrote, there is no evidence to support a clinical beneficial effect of calcium. Of the 101 studies, they specifically singled out 2 that looked at in-hospital cardiac arrest. One was in children, and they found that calcium administration was associated with worse outcomes and lower survival to hospital discharge, so not good. As far as patients who were not in cardiac arrest, they did cite one study that looked at EKG changes after calcium administration. There weren't a ton of EKG changes after calcium, and the ones that did convert, they were lame, like improvement of first-degree AV block, escape beats, and right bundle branch block. Not necessarily setting the world on fire, and the authors wrote, limited clinical relevance. Now, I don't think that we can necessarily put away the calcium just yet. These studies weren't perfect. As far as the 2 cardiac arrest studies, the authors provided that they included a limited number of patients, and there was, quote, a critical risk of bias primarily due to the risk of confounding and resuscitation time bias. So keep in mind that I don't think that the authors here were trying to make a case one way or another for calcium administration or anything else in hyperkalemia treatment. It's not like other papers I know where there's clearly an agenda. These authors just reviewed the data and they reported it. I always kind of poke fun at this conclusion, but more study is certainly needed before we change practice. But this article was food for thought.